Hello everyone, how are you all? I'm really sorry for our late today. We're having some issue with the Zoom login. Just give me a moment. I'm just going to live stream it on the Facebook and then we are going to start the session. Okay, again, please excuse me for today's delay. All right, everyone. So welcome again to First Aid AMC Clinical free 2-week session. So tonight we are going to do cardiology role play, right? So I hope that you guys already have gone through our 2 sessions on cardiology and have some idea about the important cases. So tonight is mainly focusing on doing some role play on those topics. So most of them will be known cases as we have discussed in the class, and we will see that how you are doing the role play. Okay, those of you who are in Facebook, you can come to Zoom if you actually want to do role play with me, because we can't do role play over Facebook. Okay, so I always advise for new doctors to come and do the role play with us. So if you are new, you're a beginner, I really welcome you to join the role play sessions, because that's how you learn, that's how you gain confidence. If you can do role play in front of 60 people, in front of one person in exam, it's nothing. All right, so this is how you will be strong, you will get confidence, and you will just break the chain. Okay, so I hope that you learned something from this session, because the role play sessions is there to show you where are you doing wrong and where you can do improvement. So these are extremely important. So who wants to do the first role play? Dr. Firas, you want to do? Yep. Okay. So you can unmute yourself. Others, I think Dr. Maha, Dr. Mabruka, Dr. Tithi, I have done a lot of role play with you guys. So you'll be my extra today, because we have done some role play with you. So we will allow some others to do that. And if we don't get anyone, then you guys are free to do role plays. Okay. So this is start with Dr. Firas.
Hello.
Yes. Hi, doctor. How are you?
Yeah, thank you for allowing me, Doctor. I'm completely starting from scratch. I'm not sure how will I do, but I'll try my best, inshallah.
That's what I actually want. All right, so that's fine. So most of them in here are beginners, just like you. You don't need to worry about what others are thinking, and many of these people even will not look at you or even see you in person. So there is nothing that you can do wrong to embrace yourself. So just think about, like, these are just a couple of crowds where you are talking and you are just doing it as a beginner, and anything that you do wrong, it's completely fine. Okay, let me give you the case. Just give me a minute. All right, so when we do the role play, we give 1 minute time for you to just go through the case and remember what you want to do, and then 7 minute 30 second in the inside to do your case. But in your exam, you get 2 minute outside and 8 minute inside. All right, so this is your case, Dr. Firas. Your 1 minute time is started. When time is up, I will ask you to start.
So this is a topic on cardiology, right? Or
Yeah.
any random.
Everything that we discussed today is cardiology related.
Clear. Okay.
All right, so your time is up. This is your patient, and your patient name is Sam. You can start.
Hi, Sam. My name is Dr. Firas. Nice to see you. I can
Nice to
see
see you,
that
doctor.
you had some issue like last night. May I know more about it, Sam? Is that okay?
Yeah, doctor. So now what's happening is that for the last 2 nights, whenever I get up from bed, I just feel very dizzy, and I also have been having fall, and I'm very scared that I will hit my head and I might have bleeding inside my brain. But it was good that I was able to just catch on the side of my bed and I did not hit my head.
I see, I see. That's so sorry to hear that, but it's really nice. You came at the right time. We'll try to figure out what's going on exactly. Mhm. Okay. May I know, like, is this the first time you had this event, or you had any time in the past?
No, this is the first 2 nights that I'm having it.
I see. So, like, it happened only at the night time, not in the day or so.
No, it's just during those 2 nights.
Okay. So, may I ask more about it? How did you feel exactly? Is it like something revolving, or you just out of balance, or something? Can you describe more, Sam?
I just feel lightheaded.
I see. Well, was there was it like a blackout for a second or so, or you lost your conscious, or you were like fully conscious, or at the time?
Yeah, I did not lose consciousness, but I was just about to.
Okay. Did you see things revolving around you, Sam?
I'm not sure.
Okay, no problem. Mm, I see. Do you have any other symptoms or any other thing associated with this that time? Any heartbeat or any pain elsewhere along with it?
No,
I see. Okay. Mm, okay. You had any such any history of medical illness in the past, Sam?
um, not much, doctor. I'm generally
Okay.
healthy.
Okay. Fine. Any family history, Sam? In
Mm,
your family
yes,
that runs.
my mother died of heart attack and my father died of stroke.
Oh, I'm so sorry to hear that. Okay. Mhm. And may I ask you, like, are you smoking, or are you, do you often drink?
No, doctor.
Okay, that's nice. That's a good habit. Fine. Just give me a minute, Sam. I would like to talk to the examiner. Dear examiner, can I ask you some questions, please?
Yep.
Okay. I'd like to know the vital signs of Mr. Sam. That means the heart rate, blood pressure, temperature.
Heart rate is 40. Blood pressure
Mm-hmm.
is 130/80.
Mm-hmm. Okay. Okay. Temperature and the RR.
Temperature is 36.6. Respiratory rate is
Temperature.
60.
Mhm. Okay, that's fine. Is that okay? I need to take his blood pressure lying down and sitting. Can you help me with that, Mr.
Yes.
Examiner?
Yes. So the one that I have given to you, 130/80, that was on sitting position, and on standing position, it's 110/70.
Mm. Okay, that's good. Thank you. I'd like to ask his the general appearance of the patient, Mr. Sam.
He looks
Is
comfortable.
he comfortable? Okay, fine. Mm. Any skin changes or any pale or in general?
No.
Mhm. Okay, fine. Okay, I'd like to examine his cardiovascular system. Okay. Um, like I would like to, is there any murmurs or anything upon any heart sounds apart from the sound one and sound two?
No.
Okay. Um, on inspection, do you see any cardiac impulse?
No.
Mhm. If you could palpate for me, I would like to know, is there any apex? How is his apex beat? Is it like normal?
It is beat in normal position.
Mhm. Okay. Any palpable thrill?
No. No.
Mm, okay. Fine. If you could look onto his neck and let me know his GVP, is it raised or is it normal?
Normal.
Mm, okay. I'd like to auscultate his carotids, both the sides, and let me know if there's any altered sounds.
Normal.
Mm, okay. I'd like to completely examine his CNS system. Mm, the-
All normal.
Okay, fine. Do you have any office tests, Mr. Examiner?
Like.
Yeah, like ECG.
Yeah. So ECG shows sinus bradycardia.
Okay, thank you. Okay, right. For now, I'll like to tell you the differential diagnosis.
Okay.
Sorry, I need to tell to the examiner or to the patient.
As given in the task.
Okay. Hi, Mr. Sam. Sorry to keep you waiting. I would like to, after examining, I have some points I would like to discuss with you, Mr. Sam. Is that okay?
Well, thank you, Dr. Firas. I know that this is very, very new for you. You have been doing good, but you will have to do a lot of role play, and you'll have to
Mm,
go through the cages again, right? Like this is a
mm,
fall case, which has some relationship with the cages that we have discussed. But
okay.
once you go through the cages, do some role play, this will become much better. I will not
No
give you
problem.
the diagnosis or anything at the moment because we will do the same case with someone else and we'll see how they do.
Okay.
Okay.
No
And
problem.
we'll
All
at
right.
the end we'll go for it.
Okay.
But you are doing good. Your
Thank you.
approach is very nice. So keep it up.
Thank you, doctor. Thank you for giving me a chance. I'll try to improve.
No worries. We'll be fine.
Thank you.
Okay. Thank you.
Thank you.
Okay. Now I will give a chance to someone who is a little bit more prepared. So let's see. Dr. Sumita, you want to give it a try?
Yes, I would like to try.
Okay.
Hello.
All right.
Yeah.
So this is the same case, and I'll give you 1 minute time, and we'll do the same case. Okay.
Yeah.
All right. So you get 1 minute time, and then we will start. Okay. So this is your patient. Your patient name is John. You can start.
Hello, John. This is Dr. Sumita here. I am the doctor who will be taking care of you today. I
Hi, doctor.
understand from my notes that hello. I understand from my notes that you have come here because you had some recent episodes of fall. Is that right?
Yes, doctor.
Yeah. All right, John. I would just need to confirm with my examiner if you are vitally stable to proceed further. So, excuse me for a minute. Examiner,
Okay.
I would like to know if my patient is vitally stable for further history.
Proceed to your task.
Uh, all right, John. Thanks for waiting. I understand that you had a fall last night. So, is this the first time that this has happened?
Yes, doctor. This is for the first 2 nights. This is happening.
Okay. So before the fall, what were you doing?
I was just sleeping. So suddenly I just got up and I was feeling very dizzy and I had a fall.
Okay. All right. And did you, before the fall, did you feel any lightheadedness?
Yeah, I was feeling lightheadedness.
All right. Okay. Any blurring of vision or any headache?
No,
Any weakness of arms? Weakness of the limbs?
no, no,
Okay. So when you had a fall, John, did you lose your consciousness?
no.
Okay. So you managed to get up on your own?
Yeah,
All right, John, did you hit? Did you have any injury to your head during the fall?
no,
Okay, John, that's good. Uh, and after the fall, did you feel drowsy or confused?
no,
Okay. Any weakness of limb or any slurring of speech or any visual
no,
problems? Oh, yeah. Okay,
no,
John, did you have any associated chest pain or feeling short of breath?
no,
Any racing of heart?
no,
All right. And did you have any fever recently or any uh, cold, cough, any flu-like illness?
no.
Okay. And are you feeling quite tired nowadays?
No, doctor.
Okay. Uh, h- how is your health otherwise? Any history of any diabetes or high blood pressure?
No, doctor.
Okay. Are you on any medications?
No, doctor.
All right. Okay. Any problem with your vision or you have
Not
glasses?
much. I'm fine. Yeah. No, I can see clearly.
Any pain in your joints?
No, doctor. It's just like a usual pain when you are 70s.
Oh, okay. Okay. All right. Did you skip your meal last night?
Yeah, I did not have my meal.
Okay. All right. All right. And the previous night as well?
Yeah, I usually for the last few nights I've been just skipping meal because I don't feel very I
Okay.
don't have that much of appetite.
All right. Do you smoke, John?
No,
Okay. Any alcohol?
just occasionally.
Recreational drugs?
No.
All all right, John. Thank you for sharing the details. I would just get back to you in few minutes. Okay. Uh,
Sure.
uh, Examiner, I would like to know the general appearance of my patient.
Comfortable.
Okay. The vitals, blood pressure in standing and sitting position,
Blood 130 by 80 sitting, 110 by 70 in standing,
heart rate in rate and rhythm,
heart rate 70, rhythm regular,
okay, and the temperature, saturation, and respiratory rate.
normal,
Okay, I would like to know if my patient has any pallor, icterus, any edema or dehydration.
negative,
I would like to do a complete body examination, systemic examination, focusing first on cardiovascular system. Uh, on inspection, any visible impulse, cardiac impulse.
no,
On palpation, any the position of the apex beat,
normal,
and no any palpable heave or thrill.
no,
JVP is normal.
yes,
I would like to do a complete central nervous system examination with cranial nerves involved. Is it normal?
normal,
Okay. Other systems,
normal,
abdomen. Okay. Uh, I would like to know the office test, if done any, blood sugar levels,
4 millimeter per millimole per liter,
okay. uh, urine dipstick,
urine dipstick shows 3 plus leukocyte and 2 plus nitrate,
okay, and ECG,
normal,
ECG, okay. All right. Thank you, examiner. I would get back to my patient. Uh,
okay,
John, thanks for waiting. Most likely, the fall from the history and from the details from the examination, I most likely you have a condition which we call as postural hypotension. That is, there is a fall in the blood pressure when you change your position from lying down or sitting position to to uh, to standing position.
normal,
This may be because of various reasons. This can be because of any vomiting or dehydration, or as in your case, it might be because of you skipping your meals. That is one reason. Uh, s- so that is one probable cause, and the other reasons could be salt and electrolyte, salt and water imbalance in your body. There are other reasons for falls, like like it
Time
could
up.
be related to heart.
Dr.
When
Sumita, time up.
all right. Okay.
Okay. All right, no worries. You did really good, Dr. Sumita, but only
Thank you,
one
doctor.
thing is missed. Only one thing is missed in the diagnosis. What's that?
Uh, in the diagnosis,
It's right that it's a postural
got confused
hypotension, but
in
what's the reason? UTI, because you got leukocyte and nitrite in
UTI.
the
Yeah.
dipstick. If you ask
Yes, yes.
a little bit detail, you will find out that why the patient getting up at the night time, because he's getting increased frequency of urination.
Oh, okay, okay, okay. All
Okay.
right.
Yeah.
Yeah.
So this is a, remember, like postural hypotension can be due to a lot of reasons. One most commonly is polypharmacy. For a 70-year-old, that would be our most likely cause, but he's not on any medication, so that's not the case. It could be due
Right.
to, as you asked about vomiting, diarrhea, so that's one of the other cause. Infection itself can cause postural hypotension, especially flu-like illness, any UTI, any kind of infection. In a 70-year-old, having a very sudden onset fall, always try to rule out infection, like try to ask about UTI questions, ask about pneumonia question and upper respiratory tract infection question. Those are the three common ones.
Okay, okay.
All right.
Yeah, thank you.
Even
Thank
when
you.
that's all right. So even when you get that in your office test, even at that time, before giving the diagnosis, if you just ask the patient that I forgot to ask you a question, please excuse me for that, but have you been going to the toilet more than usual these days? Or have you got any burning discomfort while passing urine? You might get a little bit of positive finding. And also you can just find out that like other causes like any vomiting, diarrhea. So even if you miss something in your history, but in physical examination you got something positive that you haven't asked in history, you can always just ask it. Okay, so in that way it will be covered. So don't think that if you did not ask it in the history and now after physical exam, if you ask it, they will not mark you. They will. As long as you are asking it, you are fine.
All right, I'll do that.
Okay, but you did good. Sure. So all the questionnaires are fine. So I think like your initial approach was all right. And it's a good idea to say that I understand from the notes that you had a recurrent fall over the last 2 nights. You must be really stressed, but now that you are here, I'll do my best to find out the cause and manage you accordingly. So you can ask about the vitals for this case initially, that's fine. And then you start asking all the pre-syncope, syncope, and post-syncope question as you did. And also, after that, you go to the DDs as you did with the CNS, CVS, and then there are miscellaneous. For a recurrent fall, as you asked all of those, like hypoglycemia. This case could be hypoglycemia because he was skipping meal. So that would be one of your DD as well. But like UTI would be the first cause. And then you can say that it could be due to that you are skipping meals causing low blood sugar. And while I measured your blood sugar today, it was just marginal. Like 4 is marginal, right? So that you can also say. And vasovagal syncope, unlikely at this case. Postural hypotension, obviously you already got from the note, from the question, that patient feeling dizzy while getting up from the bed. So then ask all the postural hypotension causes, right? So vomiting, diarrhea, all the infection causes and medication causes. And then just other DDs as we have discussed. And lastly, ask about all the past medical history, medication history, family history. It's a good idea to ask about who do you live with? Do you have enough support at home for 70-year-old?
Okay.
Okay. And also for a recurrent fall, we always try to find out their home situation, like any loose carpet, any poor lighting at home. Those are also important questions.
Yeah.
Okay. And the physical examination, you can be quick in this case. So you did quick physical examination. That was all good. And as you can see that your case I have given as little different from the other case that Dr. Firas has done. Dr. Firas' case was postural hypertension with sinus bradycardia. And your case is recurrent fall due to postural hypertension, but likely due to infection. Okay, so in exam, anything can come. So always keep your head and brain open and just give the diagnosis according to your finding. Don't think twice. If you get some finding, include that. A patient can have multiple reasons of having a fall. Like the case that we have discussed in our class, that case patient have a peripheral neuropathy, patient have a diabetic retinopathy. So a patient can have multiple cause of having a recurrent fall. So always include all the causes.
Yes. Yeah. Okay.
Okay. All right.
Yeah.
Thank you, Dr. Sumita.
Thank you.
All right. So any of you guys have any question? Okay. So that's fine. We'll do the next case then. So from here, I can see the next one was Dr. Jiteshri. Do you want to do it now? And Dr. Firas, your diagnosis was postural hypertension and also sinus bradycardia. Now, sinus bradycardia and postural hypertension is different things, so you will have to include both in your diagnosis and DD. So, Dr. Jiteshri, you can unmute yourself.
Yes, sir, I have.
Hi, how are you?
I'm good, sir. How are you?
I'm good, thank you.
Yeah.
All right, so you ready to do your case?
Yes, 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 sir.
The sounds are coming a little blurry from your end. Can you say something like, let's
Hello?
see that maybe, yes.
Yeah, it's
Okay,
audible?
it should be fine. No, it's just getting, are you on a microphone?
Yes, sir.
I think that microphone, maybe it is lost or not connected properly somehow. It's the sounds is not very clear.
Hello? Is it audible now?
Now it's good. Yeah.
Okay.
Okay, so this is your case
Yes, sir.
and your 1 minute time just started.
Okay.
All right. So this is
Yes.
your patient. Your patient name is Sarah. You can start.
Okay, sir. Hello, Sarah. My name is Dr. Jiteshri. I'm one of the GP who will be consulting to you today. Here I would like to help you with your problem. I got to know from the history that you have some issues related to your heart rate. Can you please tell me more about?
Yeah, doctor, for the last 2 hours, I'm just feeling racing of my heart, and it feels like my heart is just coming out of my rib case. It's just a
Okay.
thumping feeling that I've never had.
Yes, yes, no worries. We'll do some investigation and we'll let you know what is the problem going on. This is the first time that you are feeling racing your heart?
Yes, doctor. This is the first time.
Okay. And are you having any complaint of pain in your face? Are you feeling dizzy?
I feel a little bit dizzy, but no chest pain.
Okay. Are you taking any medicine right now?
No.
Okay. Are you suffering from any other illnesses?
What do you mean?
Like any psychiatric illness or diabetes and blood pressure?
No. Hello?
Okay. Do you have any complaint of having swelling in your feet?
No, doctor.
Okay. Are you having complaint of difficulty in breathing?
A little bit.
Little bit. Okay. And do you have any family problems like any stress in your family life or something?
No, doctor.
Okay. Do you have any family history of having heart disease?
No.
Hello?
Yes, doctor. I can't hear you.
No, sir, I'm not able to hear you. Hello?
Yes.
Hello?
Doctor, can you hear me? I can hear you.
Yes, yes, now I'm able to hear you, sir. Okay. Just to wait for a minute. I'll ask examiner about findings and we'll get back to you. Dear examiner, can I please know about her vitals?
Sorry, doctor. Your sound is coming really blurry and I can't understand most of it. I
Hello?
think like there is a little bit. Yeah.
Yes, sir. Me, same is happening to me too. Hello?
Yeah. I think like, yeah, let's just stop in here because
Okay.
actually I don't think anyone can also understand.
Okay.
Okay.
Mm-hmm.
I think like maybe try to change that microphone. I think that's causing a little bit difficulty because the
Okay.
sounds are breaking down when it is coming.
But right now I'm able to
Or
hear
maybe
you,
just
sir.
try. You can?
Yes, sir.
Okay, you still have some time, so you can go on. All right. So
Okay.
I'll try my best to understand. So
Yes, sir.
that's your investigation.
Okay. Yes, sir. May I know her vitals, blood pressure and
And the blood pressure is stable.
okay. And how about her physical appearance?
You don't need that because your task is just getting investigation from the examiner.
Okay, okay, okay. Uh, Sorry, Sarah. I have confirmed your findings with my examiner, and your ECG is showing irregular heart rate that is causing the problem with you. There may be many reasons for this kind of findings in ECG. It can be because of disorders such as thyroid disease, because it is most common in middle-aged women. So we need to do further investigation to rule out if you have any thyroid disease or not. Apart from that, the reason for this, some other psychiatric illness can also be there that we can rule out. And to confirm any cardiac disease, we need to go further. Like we'll have to do detailed investigation, like to the echocardiography, that is the ultrasonography of heart, by which we can know some ischemic heart disease or any other structural heart disease. And for that, we need further investigation.
Okay.
Do you want me to ask anything else, Sarah?
No.
Hello?
Hello. Okay, your time is up, doctor.
Yes,
Sorry.
sir. Yes.
Okay, so I think like there is a lot of things that needed to be changed, Dr. Jiteshri.
Yes,
I think
sir.
you are also new, but that's
Yeah.
totally fine because
Yeah.
that's why you are here to learn.
Yes,
But the
sir.
first thing that you will need to do is to change that microphone so that your role player can hear you properly.
Yes,
The
sir.
next
Yes,
thing
sir.
is get a role player or get a steady buddy and
Yes,
do a
sir.
lot of role play. Okay,
Yes,
once you start doing that, you'll feel the rhythm, and
Yeah.
that one by one, next question you don't need to think about it. You spontaneously it will come into your brain. So
Yes, sir.
that usually comes after doing a lot of role play. Okay,
Yes,
we'll
sir.
do the
Yes, sir.
same case with someone else who is more
Okay.
prepared, and you'll
Yeah.
see that what difference you will need to make. Okay.
Okay. Yes, sir. Yes, sir.
All right. Thank you, dear. Bye.
Yeah. Thank you, sir. Thank you.
All right. Dr. Ismodara, you want to come?
Doctor,
Yeah.
are
You
you
want to do this
hearing me
case?
properly, doctor?
Yeah, I can hear you properly.
Yeah, thank you, doctor. Yeah.
You can start the case if you want. This is Sarah.
Hello, I'm Dr. Smotaram, the working doctor in this ED setting today. Nice to meet you, Sarah.
Nice to meet you, doctor.
Sarah, from my note, I got to know that you're feeling a bit abnormal sensation in your chest. I'm sorry to hear that. And from my note, I'm also confirmed that you're vitally stable. And I'm going to discuss with you overall situation, what's going on behind your situation. Is it all right for you?
Yeah.
Okay, sir. Can you please tell me in detail what exactly are you feeling for the last 2 hours?
So I was just running on the street as part of my regular jogging, but suddenly I started to feel like my heart is racing, and I can feel it's just thumping out of my ribcage, and I'm not feeling very well, doctor.
Yeah, I'm sorry to hear that, Sarah. Did it started suddenly?
Yes.
Okay. Before it is starting, are you feeling any palpitation, any dizziness?
I feel palpitation and yes, also dizziness. Not before that, just after happening that.
Okay. Okay. So, may I know, is it for the first time you have experienced this kind of sensation?
No, I also failed this 2 other times, but I did not think about it because it just spontaneously resolved.
Okay. So, are you thinking that it is getting worse?
I'm not sure because normally within 2 hours it gets
Mhm.
better, but this time it is not.
Okay, yeah. Can you please just tapping for me? What is the exact kind of feeling it is?
Where do you want me to tap?
Just in front of me, Sarah.
Okay, it's like
Yeah.
I'm not sure, but it might be like
Yeah. Thank you, sir, for your effort. Okay, sir. So with this palpitation, do you have any chest pain?
no,
Okay. Anytime, any funny racing of heart?
just at this time and other 2 times.
Okay. Do you have any previous heart condition like any ischemic heart disease before?
What is ischemic heart disease, doctor?
Like any heart attack issues in the past?
No.
Okay. Sir, anytime do you have any diagnosed any brain condition like any stroke in the past?
No.
Okay. Sir, any recent history of high-grade fever?
No.
Any rashes in the body?
No.
Any history of head injury in the past?
No.
Okay. Any cough and sort of breath?
No.
Okay. So Sarah, may I know, do you have any previous medical condition like high blood pressure or diabetes?
No.
Okay. Are you taking any regular medication?
No.
Okay. Sarah, are you feeling that you're looking a bit pale and tired nowadays?
No.
Okay. Sarah, I'm going to ask you a bit sensitive question, but it will be very confidential between you and me. Sarah, can you please tell me, are you generally anxious person?
No.
Okay. Are you like to water things? Are you like to arrange things in a water?
Yes, I do.
Okay. May I know what are you doing for a living?
At the moment, I'm just not doing anything because I just living at home alone.
Okay. So how can you manage your daily expense? May I know that?
I get Centrelink payment.
Okay. Sorry, Sarah, do you have any stress going on at your home right now?
No.
Okay. Sarah, may I know how is your menstrual cycle? Is it regular?
Yes.
Okay. Sarah, may I know, do you smoke?
No.
Drink alcohol or any recreational drugs?
No.
May I know, like excessive tea or coffee intake?
I'm not sure it is excessive or not, but I drink 6 to 8 cup of coffee. But I think that's normal.
Is it a daily intake, Sarah?
Yeah.
Okay. Sarah, thank you so much for all the information. Now I'm going back to my examiner. Dear examiner, may I know the investigation that is needed for me?
Which investigation?
Doctor, I want to examiner. I want to know the basic blood investigation, blood sugar level, and ECG.
Okay. On the ECG available.
Yeah, thank you, examiner. Okay, so I can see the dual bleed ECG finding of my patient Sarah, who is presented with me for palpitation for last 2 hours. Regarding the ECG, I can appreciate that rate is bit related to nearly 100 beats per minute. Rhythm is not regular. Regarding the P wave, I can appreciate properly the P wave is not present there. And regarding the QRX complex, it seems to be a bit narrowed. And ST segment is normal. There is no abnormality in the T wave, and there is no visibility of the pathological Q wave. So according to the ECG finding, it seems to me like my patient is having a condition. It's called atrial fibrillation. So from the history and physical examination findings, Sarah, it seems to me like you're having a condition called atrial fibrillation. So it is an rhythm abnormality in the heart. So this is a bit concerning, and it can lead to some complications in the future. Due to this abnormal rhythm, it leads to formation of the emboli in the heart that leads to the brain, causing a stroke. Sometimes it can lead to the heart failure in the long run, and it also leads to the vessels in the limb that leads to deep vein thrombosis. Are you getting my point?
Yeah, doctor. It sounds very scary.
Sarah,
Emma?
yeah.
Thank you. All
No.
right. So you did good, Dr. Ismotara, but the history, still I'm not totally happy. The only
Yeah,
reason is that
good.
the reason is that this is very usual case, right? Like you might have been seen that case a lot. So in
Yeah.
this sort of cases, examiner will also not be happy if you do any kind of mistake or if you don't ask the important history questions. So the important thing is that when a beginner does the role play, they will always ask about past medical history, medication history, family history at the first. But when you go to the exam hall, you can't do that because it exactly shows that if you are well prepared or not. Okay, so always remember one thing, there is obviously a history format that needs to be prepared and that has to follow that. Because if we ask about, like let's say we asked about palpitation question, and after finishing the palpitation question, we are asking about any past medical history, family history, we are going toward the medication. That means which is supposed to be the end of the history. That
Yeah.
shows that the candidate forgot about the differential diagnosis, and that examiner easily can understand. I know that it just come in the head as a reflex most of the time because we want to know about the past history first. But the format is first you ask about the presenting complaint, then you go to the differential diagnosis, and lastly you finish with past medical history, family history, and all other things. Okay?
Yeah.
You are doing really good, Dr. Tithi. But this format, you'll need to just make it in your head that that's what I'm going to do in the exam. Okay. And other than that, what differential diagnosis you haven't asked? Very important is that
Doctor,
CVS,
you did family history of heart disease or sudden cardiac death, isn't it?
I'm not very bothered about family history anyway. But the thing that bothered me is the endocrine history. Someone having palpitation, we should not forget about hyperthyroidism.
Thyroid.
We should not forget about hypoglycemia. We should not forget about pheochromocytoma. Those are must. Okay.
Yeah.
Because thyroid can come as palpitation. It's a very common presentation. But other than that, you did really good. You asked all other history like infection, anemia, some CNS question, and menopause was also important. Just ask a little bit menopausal symptoms, maybe even if they say regular period in middle-aged patient. You asked about psychiatric question like generalized anxiety disorder. That was very good. Tea, coffee also very good. So history was not that bad, but only thing that was missing is endocrine. Okay, but endocrine is important. Like CNS, CVS, endocrine, these three is the main three. And then you can, even if you forget about anxiety, anemia, they would not be that bothered. Okay. And other than that, investigation from examiner. When you go to the exam, never say that, dear examiner, do I have the investigation? Always ask what investigation you are after. That way, examiner will be happy. Even though in here it is written that comment on ECG, still just ask that, dear examiner, can I please have the ECG of my patient? Rather than saying that, dear examiner, can I have my investigation? Okay.
Yeah.
So these are small things which will make you show that you are very well prepared than other candidates. Okay, let's actually filter you out from a lot of other candidates. Then the diagnosis, I know that you are running out of time and then you finished it, and that's really good that you first just said it's an irregular rhythm and then it causes stroke and also heart failure. That's a very smart way that you finished it, and they will have to pass you this case because you finished the whole thing and not much of a problem you have done. But if you get some time, then try to explain it by giving some time because they need to understand it. Because last thing that you said, it was very fast and patient will not understand it. Like, and try not to use too much of a medical jargon like emboli, ischemic heart disease, as I have already got you. A lot of time they will just got you multiple times in the exam and you will feel so disturbed just for this. So emboli, just say clot. So try not to use too much of a medical jargon in the exam, because some of the role player, they are just there to pick you, and they will just make your case look very bad. Okay, so don't let them do it.
Yes.
And the ECG reading was fine, but in here, don't say that what's the rate here, because you will have trouble to get the rate. Just say that rate is increased, then say rhythm is irregular, and then talk about all those POF, QRS, and others are fine as you did. Okay.
Yes, doctor.
All right, but you did good. All I am saying is that you are really good, but these are the things that you will need to improve, because
Yeah, the
I know
form.
that with this preparation, if you go for the exam, you will be more than fine, but you don't want to get some unusual experience in the exam. That's
Yeah.
why I'm picking on you a lot. If you are a beginner, I would not pick you.
Yeah.
Okay.
Doctor, I had just a little bit like confusing question in my head. Like I just wanted to know like how UTI
Yeah.
leads to recurrent fall, just for my understanding, doctor, just to clear my
Yeah.
confusion.
It's not just the UTI. It's actually about what happens is that it's a little bit of like both of these together making the thing to happen. Patient might have UTI, and that's why he's having increased frequency of urination.
Yeah.
Because of increased frequency of urination, he needs to get up at the night. And when he get up in the night, just he's passing a lot of urine. So his volume is already down. When he suddenly get up from the bed, the blood pressure drops and he
Okay.
gets this fall. Okay. So
Yeah.
these are a little bit of interconnected, but the main thing is that patient having UTI, having increased frequency of urine, volume of blood is going down, and sometimes if they are not careful, especially elderly patient, if they just need to go to the toilet immediately and very suddenly if they just change their position, they can get little bit of postural hypotension anyway. Okay, so you will just need to say that it's postural hypotension, explain what is postural hypotension, and say that it could be due to increased frequency of urination, you are going to the toilet more than usual, you are having decreased volume of your fluid in the
Yeah.
body, and suddenly when you are changing position, you are getting dizzy because your blood pressure is falling.
Yes, doctor. Yeah. Now it's clear to me. Yeah. Thank you so much, doctor.
No worries. Thank you, dear.
Yeah.
Good question. Is QRS is narrow in here? I would not say it's very narrow. It's usually actually looking normal QRS to me also. So the narrow QRS is like very narrow, especially you get narrow QRS in SVT. You can get narrow QRS in AF also, but this one does not look like narrow. And what will be the findings of sinus bradycardia? Nothing actually, like patient can only have a syncopal attack sometimes. Patient can have little bit of dizziness. Sometimes even they can have a fall if bradycardia is very severe. So symptomatic bradycardia, they can actually get this fall or syncopal attack. But symptoms will be only feeling little bit of dizzy. All right. So I hope that you guys are getting these cases. Even if the cases are very well known, even still you can make mistake. That's what I'm trying to say, that when you do the role play, usually always we get something is wrong, something you guys need to improve. So that's why role play is important. When you do this role play again, maybe in another week with your study buddy, you will not make this mistake. That's how you make these things in your head. Once you do one case role play, you learn a lot. Then you do another role play for the same case, you don't make that same mistake. And that thing get registered in your brain, and you will never do any mistake in the exam. So doing the role play is all about this AMC clinical. As much as you can do it, it becomes easier. All right, so that was this case. Now let's do the next one. Dr. Jainab, you want to do? Okay, so if Dr. Jainab is not here, then what's the next one? Dr. Saba? Dr. Saba? Okay. All right, so who was next? Dr. Numra, yes, you can try. You can unmute yourself.
Hi, good day. This is Namra. How are you doing?
Hi, I'm good. How are you?
Good, thank you.
Okay. All right, so we'll do the case. So just give me a moment. I'll give you the case. Okay, so that's your case. Your 1 minute time just started. Now, you have the ECG given in the stem. You want to look at the ECG, just let me know and I will show it to you. Your
Sure,
1 minute
thank
time
you.
just started.
All right.
All right, so this is your patient, David. Your time starts.
Hi, David. My name is Namra. I am one of the doctors who will be looking after you here. I read from the note that you are having this chest pain for 30 minutes. I am so sorry to hear that. Are you still in pain?
Yes, doctor.
All right. Dear examiner, I just wanted to arrange quickly the pain medication and then I will proceed further.
Okay.
John, just give me one. Sorry, was it John? What was your name?
David.
How may I address? Yeah, David. Sorry, David. I would like to make sure that you are vitally stable, and in the meanwhile, the pain medication will come. So we will handle this. Dear examiner, I would like to make sure that my patient is vitally stable. So, what is the blood pressure?
Blood pressure is 130 by 80.
All right. And what is the pulse rate and rhythm?
Pulse rate is 80, rhythm regular.
All right, great. And everything else, respiratory rate, oxygen saturation, and temperature?
Good. Normal.
All right. I would like to shift my patient to the resuscitation cubicle, and I would like to attach him to the ECG monitor and pass the 2 IV lines and take bloods for further investigations. David, can you please tell me where exactly is the pain?
In the left side of my chest.
All right, on the left side of your chest. And since when it started? I see that it's 30 minutes. Was it 30 minutes ago?
Yeah.
Has it started suddenly, or it builds up gradually?
Suddenly.
All right. And how exactly the pain feels like?
It feels like someone is crushing my heart.
Oh dear, I'm sorry about that. Is it radiating? Is it going anywhere else?
Yeah, it's close to my left arm.
All right. And have you taken anything for that? Anything that has helped?
Nothing, doctor.
What were you doing at the time when it started suddenly?
I was not doing anything, doctor. I was just sitting on my chair.
All right. And can you think of anything that has made it worse or that has brought it on?
I'm not sure.
All right. And from 0 out of 10, how would you score it? 10 being the highest.
It's 9 by 10.
9 by 10 at the moment. I'm sorry about that. Surely someone, I am arranging the pain medication. So nurse will be here and she will take care of that. In the meanwhile, are you happy to proceed further?
Yeah.
All right. So are you having any difficulty in breathing?
Yes, doctor. I feel some short of breath.
All right. All right. So I will arrange some oxygen as well, just to make you feel a little better. How about any lightheadedness?
No.
Any nausea or vomiting?
I feel nauseous.
All right. Any increased sweating?
Yeah.
All right. So have you traveled anywhere recently?
No.
Did you had any fever or
No.
runny nose recently?
No.
Any history of trauma, any accident?
No.
Any correlation with the food?
No.
Like any bitter taste in your mouth, or any correlation with the food, or after eating spicy food, you are feeling like that?
No.
Is this happened for the first time, or has it happened before as well?
First time.
All right. And when you touch it, is it sore?
No.
The left side of your chest? No? All right. And
No.
is there any rash anywhere on your body?
No.
All right. David, are you generally an anxious person? Do you get worried on trivial of things?
No.
All right, that's good. Do you have any past medical conditions I should be aware of?
I just have high blood pressure.
All right. And any other thing like diabetes, any cardiac condition?
No.
Great. And any family history of having any cardiac condition, diabetes or hypertension?
No diabetes or hypertension, but my father had heart attack.
And what was the age?
I'm not sure, doctor.
That's all right. Do you smoke, David?
Yeah.
All right. For how many years?
Since I was teenage.
All right. And do you drink alcohol? Any illicit drug use?
No.
All right. And any medication that you take regularly?
No.
All right, great. David, just give me 1 minute. I just want to take the ECG from the examiner, and I will get back to you in a minute. All right.
Okay.
Hi, dear examiner. Can I please have the ECG? Thank you. All right. Sorry, do I have to explain the exam? Sorry, can I look at the task again? All right.
I'm up.
Oh, sorry about that. Okay.
Time. So you can't take that much time in the ECG, okay? Because
Okay.
that has to be very spontaneous. You don't even need to
Yeah.
think about it. Just
Sorry about
yeah.
that. I just
So-
thought I just realized that I didn't ask ruling out question about pericarditis, and it looked like pericarditis.
Yeah.
Maybe.
All right.
Yeah.
Now,
All right.
when it is a brief history, it means
Yeah.
that you have a lot to do in your other tasks. Okay. So
Okay.
and also you miss the chance to look at the ECG. If you just say that, yes, doctor, I would like to see the ECG initially in the
Yeah.
first 2 minute time, you would
Yeah.
already know what is this case all about. Because
Mhm.
if you look at here in the ECG, what you see, let's look at the
Yeah.
V1. V1 is
Yeah.
not very important. So there is some T wave inversion.
Yes.
Now then look at the V2. If you look at the isoelectric line, so there is ST elevation here
Yes.
and also T wave inversion. So you have got ST elevation, T inversion. Same with the
Okay.
V3, same with the
Okay.
V4.
Yeah.
V5, you can't say any ST elevation, just say T inversion.
Yeah.
V6 having some ST elevation and
Mhm.
little bit of T inversion.
Okay.
You can also see a M pattern here, right? So
Yeah.
that's most likely associated left bundle branch block.
Bundle
If
branch
you miss
block,
that,
yeah.
that's fine.
Okay.
Okay. And then if you look at lead 1, it's also ST elevation.
Mhm.
AVL also ST elevation. So this patient has got anterolateral
Anterolateral
myocardial
stem.
infarction.
Yeah. All right.
Yeah. Now, why I said that? Because if you look at lead 2, there is no ST elevation. Lead
Yeah.
3, no ST elevation. Lead AVF, no ST elevation. So there is no reciprocal problem in here.
In
Okay,
yeah,
so
in
if there was
inferior
ST
leads.
elevation
Okay.
in lead, yeah. Okay, so if there was ST elevation in these leads, then you could think
Mm.
about possibility of pericarditis. But
Okay.
patients, the symptoms are very, very much going with the heart attack or MI,
Yeah.
and then also the ECG. Okay.
All right.
Now, when you have got such a case, brief history
Mhm.
means you can ask a little bit of DD, but obviously not anxiety questions on all of those, not needed at all, because you already
Mhm.
know the diagnosis from ECG. You'll just
Okay.
ask the relevant history. That means chest pain characteristic, all the
Mhm.
MI symptoms that you asked, maybe a
Okay.
little bit of pericarditis differential you can rule out, pulmonary embolism, pneumothorax you can rule out. That's all. Then lastly, you just ask a little bit about the cardiac risk factor, which is that ABCDEFS. So alcohol, smoking, blood pressure, cholesterol, exercise, family history, those kind of history you can ask.
All
And
right.
then immediately you go to the ECG, explain the ECG, don't take that much time, just start it. Maybe just take 10 seconds and then you will have to start.
Okay.
Explain further management with the patient. So in this case, if I give you the time, how are you going to explain this? Just try to explain what you have found and what are you going to do for this patient. Can you do that?
Yeah, sure. Hi, David. So, from the ECG and history, your likely diagnosis is having that you are having myocardial infarction. So, this is the ECG that is the capture of electrical activity of your heart, and in your case, it shows that your heart is not having enough blood supply, and that's why you are having this chest pain and difficulty in breathing. So, the ideal situation in this case is usually doing try to lodge the clot out, but in your case, since the nearest hospital is 4 hours away, so we are going to use an alternative approach in which we are going to give you some blood thinners, and they will help to dissolve those clots in your arteries that are in your blood vessels that are supplying your heart. All right, this will help you with the with this chest pain and with the with your heart attack. Um, in the and once I am going to involve my senior, and we are going to take some bloods, and then just to make sure that everything else is okay, and to proceed further. Do you have any other any other bleeding disorder, or any history of tumor in your brain, or any history of having a stroke?
No.
That's great. So we are going to proceed further with that, and once it's stable, we are going to tell you about further management, that how are we going to manage it, and we are going to arrange the follow-up, and we will give you proper advice that what are the lifestyle measures that you have to take regarding this. So I will involve my cardiologist. I will involve our cardiologists, which are the team of experts who manage these conditions regularly. So there is no need to worry. You are in safe hands at the moment, and we will take care of you. All right.
Okay. Thank you, doctor. Oh, that was great, doctor. So one thing that is not said so far, what was that? What is the most important thing? Like obviously the most important thing is PCI or thrombolytic, but what else?
Yeah.
What else you can give in your GP setting that can save this patient?
Oxygen, we have already given pain relief, and then nitrates.
No, aspirin.
Aspirin. Oh, sorry. Yeah, aspirin. Yeah.
Yeah. So that's the most important thing. Now, if you don't use the term aspirin in this case, you will not pass. So
Okay.
the thing is that in GP setting, the thing is there is not much to be done. Even it will be a very tricky thing to do this streptokinase or antiplase in a GP clinic. So it's really unusual unless there is no hospital nearby that can be done. But that GP setting might be a very rural one. Okay, but most of the time you would not be able to do that in a GP setting. Now,
Okay.
the thing what we have to do in a GP setting, obviously, first of all, you explain what is myocardial infarction or heart attack. Patient understand heart attack a lot easily rather than myocardial infarction. So just say that most likely you have got a condition called myocardial infarction or heart attack. And then you explain what is heart attack, as you did, it was good. Then the next management would be monotherapy. So you say that first of all, we need to admit you in here. Now, it's a little bit unusual situation, like we don't admit anyone in a GP setting. So you can just say that, first of all, I need to just keep you in the clinic for further management because the hospital is 4 hours away and we don't have enough time for you to send you to the hospital for the best possible management. So you'll need to go for that alternative management. I'm going to call my senior, and also we will liaise with the cardiologist in the tertiary hospital for further management. The first thing that we have done, that we have already taken blood for checking your cardiac enzymes and other investigations. Also, I have started you with a strong painkiller, and if you're still getting the pain, then I will start you with nitrate under your tongue. But the most important thing is I'm going to give you a 300 milligram of aspirin, which also acts as a blood thinner to prevent further formation of clot. So once you have done that, then according to the cardiologist, we will manage you accordingly. So never ever say that you are going to manage this patient. It's everything based on cardiologist opinion. Okay. Even in GP setting, you don't have senior to involve. So if it's a GP setting, you will need to involve a cardiologist. If you have a supervisor, you can involve your supervisor in a GP setting. Okay.
Okay.
And then what you can do is that after monotherapy, you have to talk about that the best option would be catheter lab in catheter lab, they would just insert a metallic wire into your heart artery to remove that clot and put a stent in so that your artery keeps open up. But in here, we can't do that. So the other option is to put you on a clot dissolving agent. But we need to ask you a couple of questions to rule out any possible contraindications for those medications. So then if you haven't asked it in the history, at least in here you can ask it. The absolute contraindication is if the patient currently bleeding from anywhere, if the patient on any other blood thinner, history of stroke in the last 12 months, like ischemic stroke or hemorrhagic stroke or head injury in the last 3 months. So those are the absolute contraindication. And if the patient does not have any of these contraindication, then you can go for that, but that will be under cardiologist opinion.
All right.
Okay. In exam, most of the time, I believe they would say that you are in a rural clinic or rural hospital. In rural hospital, you might not have that catheter lab opportunity. So in that case, you need to send them to the tertiary hospital. So it's very unlikely that they would give you this kind of case in a GP setting. But if they do, then that's what you will have to do.
All right.
Okay. And when you get a GP setting, we don't use the term resuscitation cubicle, we use the term treatment room. Okay. So hospital has resuscitation cubicle and GP has treatment room.
All right.
More or less same thing, but GP does not have a lot of things in their room. Hospital has everything.
Yeah. All right. Thank you.
Okay.
Yeah.
Thank you. And but you did really good. Okay, keep it up, but just keep an eye on the time. Time is everything in this exam.
I will, hopefully. Thank you.
Thank you. And yes, Dr. Firas, while explaining diagnosis, it's a good idea to show some empathy. If you have some time, then say that please don't get stressed. There is a lot of patients who are suffering from heart problem, and a lot of patients get heart attack. But we have a very experienced team of doctors who can take care of you. Okay, so say something nice so that they don't die from your talking. And yes, like Dr. Nandita, you can say myocardial infarction. We don't usually use the term myocardial ischemia. It's either ischemic heart disease or myocardial infarction. More or less same thing, but myocardial infarction is a good idea to say. Only aspirin. No need of giving clopidogrel because you are going to give this patient a clot dissolving agent. So that patient, if you give another blood thinner, there is increased risk of bleeding. Okay, after dissolving the clot, then you can put this patient on dual antiplatelet. All good? Of giving beta blocker ACE inhibitor, initially this patient will get all of this once he's stable and the MI has been managed. When you discharge this patient to home, then ACE inhibitor beta blocker will be added. Not at the moment. Okay. All right. So yes, we can do another case now. So Dr. Fyong Nguyen.
Yes, I'm here. Can you hear me?
How are you?
Okay,
I
I'm
can
good.
hear
How are
you.
you?
I'm good, thank you. Okay, so I'll give you another case. Just give me a minute.
Yeah.
Okay, now we are going to do some cases which we might not have discussed in the class. So just use your good judgment and experience to do these cases. Okay.
Yeah.
So this is your case. Your 1 minute time just started. All right. So this is your patient. Your patient name is Anna. You can start.
Hello, Anna. I'm Dr. Nguyen, the resident here. How are you today?
I'm good, doctor. Thank you.
Oh, from the note, I know that you have the elevations of blood pressure on 3 readings. Um, so may I ask you, so do you have any signs or symptoms right now, like headache or feel dizzy?
No, doctor.
So all good for now?
Yeah, I don't feel anything, doctor. I feel fine.
Okay, okay. And then, so may I ask you some questions regarding these issues? Is that okay for you?
Yeah.
Okay, so may I ask, like, do you notice any um any medical issue before?
No.
No? Okay. So do you feel like dizziness or feel unwell or like any mm, headache?
No.
No? Okay. And so do you have like any family history of high blood pressure?
Yes, my mom has got high blood pressure.
And whether she's on any medication for now?
Yeah, I think so.
Okay. And so whether you taking any coffee or any tea before heading to the hospital for the blood donation?
No, doctor.
Okay, not at all. Okay. And do you have any history of collapse or faint when you were previously?
No.
No, okay. Do you have any history of any kidney disease or any like sweating, sweating? Sorry. Okay. Okay. So did you skip your meal today?
No, doctor.
Okay. And so it sounds like you're okay. So you're not aware of any history of blood pressure previously. Is that correct?
Yeah, doctor, I did not know that. Am I not
Okay.
very young to get high blood pressure? Because my
Yes,
mom used to
yes,
say when you
yes.
become older.
Yes, yes, yes. Yeah, but because like you get like high blood pressure on pre-readings, which quite like um it's quite like indicates that you truly have high blood pressure. And so whether you drink much water for today.
Yeah, just a regular one, normal.
Okay. And what about the urination? Have you noticed any change of the amount of urine?
No.
It's normal, right? I assume it's normal.
Yeah.
Okay. Okay. So thank you. So I just would like to ask some information from the examiner, and I will back with you soon, Anna. Is that okay?
Yeah, that's fine.
Okay. Dear examiners, I would like to have like the general appearance of my patient. Is he like
Comfortable?
comfortable? Okay. And what about the vital sign?
So what do you want to know?
The blood pressure like is now 3 reading, but I would like to know the blood pressure on standing and on sitting.
On standing, it is 155 by 80.
Yeah,
And on sitting, it is 150 by 70.
150 by 70. Okay. And also the heart rate, is that like the rate and the rhythm?
Normal?
Okay. And the respiratory rate, the R, normal. The saturation,
Normal?
okay. And what about her BMI?
BMI normal? 24.
Okay, good. Okay. And also whether she had edema, dehydration?
No?
No, okay. Okay. And the cardiovascular system, the palpitations,
Normal cardiovascular examination?
is there any murmur?
No murmur?
Okay. And also for the abdomen examinations, any murmurs on the just around the belly button?
No.
No. Okay. And also, what about the respiratory and the abdomen examination?
Normal?
And the nervous system examination?
Nervous system is normal?
Okay. And may I have the urine dipstick, the blood sugar levels, and also the ECG? Is it available?
Not available?
Okay. And the urine dipstick, is that normal?
Not available?
Okay. The blood sugar level?
Not done?
Not done. Okay. Thank you, examiner. So, hello, Anna. Thank you for waiting. So from the history and from the examinations, you get the conditions it's called hypertension. So have you ever heard about that?
No, doctor.
Okay. So it's basically the increase in the blood pressures in your body, and sometimes it's just like it can cause headache, disease. Sometimes it might like more common in the elderly, but sometimes it can happen in the young people as well. And so for the young people, it may because of some underlying conditions like pheochromocytoma or maybe hyperthyroidism or maybe some problem in the kidney artery. So which I couldn't find any signs or symptom at this moment, but you may need to have some investigation. such as the kidney artery Doppler, or need to do some thyroid function test. So at this moment, I would like to keep you in the hospital for now and to do
I'm
some
up.
tests. Okay.
Thank you, doctor.
Yep.
All right, you did good, given that we haven't done this case, but a lot of things are also very important in this case. Okay, what I would like to do is to do this case with someone else again, and we'll see that if something important comes up.
Okay.
Okay.
Yeah.
All right. So, and then we will come to the discussion. I'll ask someone randomly. Let's see. How about Dr. Mabruka? You wanted to do some role play. This is the time.
Hi, doctor. Can you hear me?
Yeah. Okay. Yeah, I can hear you. All right. So you're going to start the case?
Can you hear me now?
Yeah, I can hear you.
Okay, yeah. Can I get 1 minute, please?
Yeah, sure.
Thank you.
Okay, you can start. Your patient name is Sarah.
Okay. Hello, this is Mabruka Islam. I'm the attending doctor today. Sarah. Okay. So Sarah, how are you doing?
Yeah, I'm doing good, doctor.
Okay, so Sarah, nice to meet you. And from the note, I can see that my nurse has measured the blood pressure, and we found that your blood pressure is a bit high on 3 readings. So is it okay, Sarah, if I ask you a few more questions to get to know what's going on?
Yeah, sure.
Okay. So Sarah, have you ever been diagnosed with high blood pressure before?
No.
All right. Okay. And are you having any headache or dizziness at the moment?
No.
All right. Any lightheadedness?
No.
Okay. And by any chance, are you feeling any blurring of vision?
No.
Any chest pain or racing of heart?
No.
Okay. All right. By any time you feel any tummy pain or any lump in your tummy?
No.
Okay. And how about your urination? Like, is there any change of urine, increased frequency or decreased frequency?
No.
Okay. And how about, do you feel these days if in any time weather intolerance
No, doctor.
or any bowel change?
No.
Okay. Anytime you feel hot flush or yeah, any hot flush or you feel?
No.
Okay. And Sarah, may I know that what do you do for living?
I work in a cafe.
Okay. And is your job is stressful?
Not much, doctor. Just usual.
Okay. And may I know that your diet in a brief?
Yeah, I try to take a healthy, balanced diet.
Okay, like is it include the veggies and non-veggies?
Yeah.
And do you drink adequate amount of water as well?
Yeah.
Okay, all right, that's great. And may I know that do you do exercise?
I try.
Okay, like how about that exercise? Like, is it you're going to gym or just walking?
No, sometimes I just walk, but I don't get that much time because I have to work 8 hours in a day.
Okay, yeah, I can understand. All right, and any recent weight gain?
No.
Okay, all right. And Sarah, do you have any past medical illness, like any chance of high blood, diabetes, or any cardiac disease?
No.
Okay, and any surgical illness so far?
No.
By any chance, any high cholesterol level?
No.
Okay, any family history of any illness, like especially any cardiac illness?
My mom has high blood pressure.
Okay, and how is she going?
Yeah, she's going.
Okay, do you smoke, Sarah?
Yes.
May I know how many, for how long?
I just started a couple of years ago, and 15 cigarettes in a day.
Okay, Sarah, it's not healthy for health. I can arrange another consultation with your consent. So do you drink alcohol?
No, doctor, just occasionally.
And you know the safe limit?
Yeah, I know.
Okay, all right. And by any chance, any recreational medication?
No.
Okay. And Sarah, are you taking any other medication that I should aware of? Especially any steroid or any kind of contraception?
Yes,
No.
I use contraceptions, doctor.
Oh, okay. For how long?
I've been using it for 2 years.
Okay. Are you compliant with the medication?
Yeah.
And have you had any side effect of this medication?
No, it's been fine.
Okay, awesome. And Sarah, thank you for your all information. Just I'll be back after the examination. Just bear with me. Examiner, can I get my examination findings?
You will have to ask it.
Okay, may I know the vitals of my patients, which include the blood pressure with the postural drop?
Yeah, the blood pressure is 155/80, no postural drop.
Okay, and respiratory rate, saturation?
All are normal.
Temperature? All normal. Okay. So may I know the any pallor, any edema?
No.
Okay. May I know if there is any JVP rise?
No.
Can I found any bruit, carotid artery bruit?
No.
Okay, I want to focus on cardiovascular examination. May I know that on inspection, is there any apex bit visible?
No.
Okay. On palpation, can I get any chill or palpable P2?
No.
Or okay, and on percussion, on auscultation, can I get any? Can I get the S1, S2, and any gallop rhythm?
S1, S2 is there, but no gallop rhythm.
Okay, any murmurs?
No.
Okay, I'd like to quickly look the respiratory examination
Normal.
and abdominal examination.
What are you looking for?
Any ascites on percussion and any dullness on percussion and any in bowel sound.
Bowels are normal. No ascites.
Okay. Thank you. Just I would like to go for the office test. If is it available? Urine dipstick, blood sugar, and ECG.
Urine dipstick, blood sugar is normal. ECG not available.
Okay, thank you, examiner. So Sarah, thanks for your long waiting. Sarah, I was, yeah.
I'm up. Give the diagnosis and the cause, please.
Okay, so yeah, Sarah, my provisional diagnosis is I found the blood pressure high. Most likely it could be due to the reason of that the pill that you are taking, the oral contraceptive pill. And but some other reason, I was also thinking it could be any cardiac condition like heart failure or myocardial infarction, but less likely. It could be any thyroid abnormality, but less likely. Could be any kidney problem, but I have not found any history from you. It could be due to any sorry, I got lost.
That's all right. Okay, that's fine. You did good. All right, it's good that you got the diagnosis. It is actually a hypertension because of oral contraceptive pill. Okay, so that's good. Now, I think like you asked a lot of important things. That's fine. Let's discuss this a little bit. So initially what you will do, a 22-year-old coming for a blood donation, always appreciate them for that. So as I said, always that's everything given in the stem, try to touch that. Like in here, we can say that, hi, Sarah, this is Dr. Arshan, one of the doctor here. How are you doing today? Yes, doctor, I'm fine. I can see that you are here for blood donation. Yes, doctor. Oh, that's really good. I really appreciate that. You're doing a good job. So see that when you do that, patient automatically becomes very, very reliant on you and they like you. That's how you make the patient-doctor relationship. It's very important. And then you can say that, well, my nurse has noticed that you are having some high blood pressure on 3 readings. I just need to ask a little bit more question about it. Is that okay with you? Yes, doctor. So that's how you are starting this case. And then everything that you said, it is really, really good. The important questions that we rule out is the secondary causes of hypertension. The mnemonic that we use for it is called TRACPADs. So TRACPAD include thyroid disorder, which is hyperthyroidism, R for renal artery stenosis, A for coarctation of aorta, C for Cushing disease or syndrome, then K for kidney problem. Now kidney problem it could be polycystic kidney disease, it can be glomerulonephritis, even sometimes if it is a chronic renal failure or CKD patient. Then you have pheochromocytoma, that's also one of the important cause. A for aldosterone, which is hyperaldosteronism or Cone syndrome. D for drugs. The important drug is if a patient taking long-term NSAID, if a patient on long-term OCP, not just long-term, sometimes even a recent intake of OCP can cause it. And also if a patient is on steroid. And you have 2 S, one is a stress and another is sleep apnea. So these are all the important questions that we will need to rule out in our questions. That's what is this case all about. So first of all, your history will be, first you did that reassurance and appreciate the patient. When you start asking question, you will ask symptomatic question, which Dr. Mabruka has done. So symptomatic question means headache, dizziness, blurry vision, pain, shortness of breath, racing of the heart. You can also ask about PVD question like any pain in the cough while you are walking. So just a little bit questions about hypertension complication. After you have done that, then one by one, you will go for these causes. So you can start with thyroid disorders. So ask about weather preference, change in bowel habit, change in body weight, any lump in the neck, any sweating, any shivering, or any tremor in the hand. So a couple of questions about thyroid. For renal artery stenosis, you can't ask any question, so that's fine. Coarctation of aorta, no question to ask. Cushing disease, you can ask about any recent weight gain. You can ask about any increased acne, any increased hair in the face, which is hirsutism. So, and also you can ask about like easy bruising, like do you get bruising very easily? okay, and any muscle weakness. So they get proximal muscle weakness sometimes. So, and also you can ask, have you noticed any changes in your face, like moon faces? You're not asking about moon faces, but have you noticed any change on your face, any recent weight gain, acne, increased hair growth, any muscle weakness? Okay, so that's Cushing disease. For other kidney problem, for polycystic kidney disease, have you noticed any lump or bump in your tummy? Any family history of kidney problem? For glomerulonephritis, have you noticed any change in your urine? You can ask about some couple of other things like frequency, dysuria questions. Then ask about, have you noticed any blood in the urine? That's for glomerulonephritis. For CKD, have you noticed any decreased urinary output or decreased frequency of your urine? For pheochromocytoma, we have a questions of, do you get episodic headache, flushing of your face, and also palpitation and sweating? So these are the 4 questions. So flushing of the face, palpitation, throbbing headache, and sweating. So that's pheochromocytoma, but that happens in episodes. For hyperaldosteronism, nothing much to ask, but you can ask about any muscle aches and pain, muscle weakness, any dizziness that can be found here. For sleep apnea, ask about, did anyone complain that you snore at night? Do you feel very sleepy in the morning, even though you have a good night's sleep? Then ask about their lifestyle, like who do you live with, how is the family, any stress in the home, any stress in the work. And lastly, ask about past medical history, family history, SADMA. In the SADMA, you will ask about smoking, alcohol, recreational drugs, and any other medication. In any female who is 22-year-old, it's very important to include that gynae questions, which is when was your last menstrual period? Any problem with the period? Because we need to rule out, is it a pregnancy-induced hypertension? Even though it's very unlikely, but still we should rule out pregnancy in any of this reproductive age group. So ask about, I'm going to ask you some questions about your period. Okay, is that all right with you? Yes, doctor. So when was your last menstrual period? Do you get it? So is it regular or irregular? And do you have a stable partner? Do you use any contraception? So at least these 3 questions should be added. And lastly, you can finish this case. So as you can see, there is a lot to ask if you know what to ask, right? So that will be your history in this case. After that, physical examination from examiner. Now, if you think about these causes, then you will think that there is also a lot to ask in physical examination. So if we divide it like this, we will start with general appearance. Then we'll talk about all the vitals. And BMI is very important here because obesity can be a risk factor for hypertension. After that, pickled. In pickled, what is important? So pallor, icterus, you can ask, not very important. You can ask about lymphadenopathy, clubbing, cyanosis, edema, dehydration. That's fine. Once you have done that, couple of other things is important. If you want to finish CVS first, that's fine. So finish the CVS. Ask the neck. In the neck, you are looking for what? You are looking for JVP, carotid bruit. These 2, if you want to finish, that's fine. But there are a lot of other things that you will need to ask here. Especially, you will need to find out in the vitals, when you ask blood pressure and pulse, add about any radio-radial delay and any radio-femoral delay. Why? Because one of your DD is palpitation of aorta, right? So you will have to ask for that in the pulse. Then when you finish CVS neck, in the neck, while you are asking for JVP and carotid bruit, also you can ask about thyroid. So I would like to do thyroid palpation, any thyroid gland palpable or not. Just one question is fine. After neck, it's a very important thing to check the eye. One is that if there is any eye sign of hyperthyroidism, and what is another one which is very important? for a hypertension patient?
Hypertensive retinopathy.
Sorry again?
Hypertensive retinopathy.
Yes, yes, good, very good. So you did the fundoscopy for that hypertensive retinopathy. So that's very important to ask. So you did your eyes. After eye, what you can ask? So once you have done that, in the face, now you're in the face. In the face, you can ask about this Cushing disease findings. So any moon phases, any acne, hirsutism that you can see. Okay. So you have finished thyroid, coarctation, Cushing. Once you have done that, then you can just quickly do the respiratory system for any bivisible crepitation. And then you can go to the abdomen. Abdomen has a lot of things. One, that's why I asked Dr. Mabruka that what are you looking for? You're looking for any kind of lump in the tummy. Why? Because if it is a polycystic kidney disease, you would be able to feel a lump in the kidney. So in abdomen, you can ask that if there is any organomegaly. You can specifically ask that, is the kidney ballotable? Or is there any lump palpable in the abdomen? So that's one thing. What else is important? Renal artery stenosis. So you're asking for any renal bruit in abdomen. So these two is very important. After that, you can just finish in the leg for any leg edema, and that should cover it. All right. So that's how the physical examination will be in this case. So there's a lot of things to be asked. And then lastly, give your diagnosis. So what is hypertension? And now when they say differential diagnosis in this case, actually you can't give differential. So you will just need to give all the causes. So say that most likely you are having a condition called hypertension or high blood pressure. So in this case, high blood pressure happens when the force on the wall of your blood vessel is more than the normal. So you can just draw something like you can draw the heart and then you can draw the blood vessel and you can say that, let's say that this is one of your blood vessel, and in hypertension, the force of the blood on the wall of these vessels get higher than normal. This means that your heart needs to work harder, and also your blood vessels are under a lot of strain, and it makes you in a major risk of having a heart condition, stroke, and other serious condition. But please don't get scared about it, because in your case, most likely, I'm thinking it is due to your oral contraceptive pill that you're taking. And if we can stop it or change it to some other pill, most likely your hypertension will be resolved. So please don't get alarmed about it. But it could be due to other reason. Then you give all these causes and say why it is unlikely. Okay, so that was this case. This is a very important case. It's very easy if you know it. If you don't know it, you will make mistake. Okay, all good? Dr. Mabruka,
Yes.
you did good.
Thank you, doctor. Give me a chance.
No worries, thank you. All right, so I think like I had a lot of other case to do role play tonight, but it's already 11 p.m. in Australia. I will give you the time to sleep today. But there are two other cases for cardiac, which I have come across. One is, I will show you, we have it here. So one is called hypertension non-compliance. So the patient who is non-compliant on antihypertensive medication, that's also very important. We will discuss that in your course. So that's fine. And also there is a case called ambulatory blood pressure monitoring. Not very important, but we have the discussion here. So those of you who are in the course already should be able to get this note. So just go through that as well. So that's this one. It's in page 115. So they say that patient having some hypertension, you can see that sometimes 140/90, sometimes 150/85. Explain the patient what is ambulatory blood pressure, what is the implication of hypertension, and what investigation you would like to do. So you'll need to explain what is ambulatory blood pressure, what is hypertension, why it is important. So it's written everything in here. You will just need to follow that. Okay. But if you are not sure, if you have any confusion, we will discuss that in the course anyway. Okay. So that's the only 2 cases, but others are all covered. Should be fine for cardiac system if you know these cases. All good? Any question? So this file in your software or in your portal, it will be cardiac role play or cardiac practice question. So you should be able to find it in the sample question folder. All right. Okay, so I hope that you enjoyed this session and understand how to do role play. Start doing role play with your partners. There is nothing important than that, as you can see. So as much role play as you do, things become much easier and you gain your confidence. Many of you has done really good today. And the reason behind it, you would say that you guys have been doing role play, right? And things were not that easy initially when you started. So you can give some motivation to the new people as well. That yes, I was also in the same position, but things got easier because we did role play, we did practice. Okay, so everything needs practice. It is not supposed to be done in a day or two. It will take time. And you have next 5 months with us and you will be fine. Trust me, those of you are doing role play with us at the moment and you can see that they're doing good. They are all our students here. So they have done the course already. So, and you will also have that much confidence in here after you have done role play, after you've done your course. Okay. All right. So you know that there is a class coming up, right? So that will be with your doctor. So there is a class, I think, for the course students tomorrow, but it's not a part of the free 2-week session. That's actually will be with Dr. Cynthia. So Dr. Cynthia takes classes around 8:30, so that should be fine. Okay, but as a part of the free session, there will be another class on 23rd that will be taken by me, which will be just a new topic, which is pediatric vomiting cluster. And in that class, we will finish your 2-week session. Still, our course admission is ongoing. So if you still have any question about the course, if you're still interested to join, make sure you start the process because it takes some time, as we say. And usually if you start the process now, you might be just need to wait for at least 3 to 5 days to get everything. So start the process so that you don't miss our orientation session. So once this free 2-week session is done, we will start our orientation class, which is very important to get the whole idea. Okay, and we will get to know about little bit more about you and your situation. All right, we have discussed about the course over a lot of time, so I don't think we need to do it tonight. If you have any questions, feel free to go in our website, and the website is, I'll just show you. So if you go to our website, which is this firstaidamc.com, and if you want to know about the course, you can go to this 5 months clinical course, and you can give it a read here, that what all the course will involve. Okay, everything is written in here, very nice and well. Still, if you have questions, you can always inbox or send email to us. Every detail is given in your Facebook, in this software or website. So any questions, anything, you can always ask again. All right. Have a good night then. Any question, guys? And Dr. Vavin, there is a class with Dr. Cynthia tomorrow. Sunday is Christmas, so there will be no class on Christmas, obviously. All right. Thank you, everyone. And thanks everyone who has participated today. Well done. Take care. Have a good night. Bye.